The appendicular skeleton is made up of bones in the upper and lower limbs. The bones that hold the limbs to the axial skeleton are called the pectoral and pelvic girdles. The pectoral girdle, or the shoulder girdle, connects the upper limbs to the sternum and rib cage on each side. It consists of the clavicle and scapula. The pelvic girdle connects the lower limbs, or the legs, to the vertebra. It consists of the paired hip bones, sacrum, and coccyx.
The axial skeleton is composed of the bones along the central axis of the body, divided into three regions: the skull, the vertebral column, and the thoracic cage. The skull is composed of 8 cranial and 14 facial bones. The cranial bones include the unpaired ethmoid bone, the frontal bone, the occipital bone, and sphenoid bone, along with the paired parietal and temporal bones. The facial bones include 6 pairs of bones in the unpaired vomer and mandible. The adult vertebral column is composed of 26 bones, including 24 individual vertebrae and the fused vertebrae that form both the sacrum and the coccyx. The vertebral column is partitioned into 5 regions: the cervical of 7 vertebrae, the thoracic of 12 vertebrae, the lumbar of 5 vertebrae, the sacral of 5 vertebrae, and the coccygeal 4 vertebrae. The thoracic cage is the bony framework of the chest. It consists of the thoracic vertebrae posteriorly, the ribs laterally, and the sternum anteriorly.
The first type of bone marking is the depression. Depressions are often the sites where blood vessels and nerves travel. There are 3 types of depressions which we will examine today: the alveolus, the fossa, and the sulcus. An alveolus is a deep pit or socket in the maxilla or mandible. This is the arc that contains the teeth. A fossa is a flattened or shallow depression that often receives an articulating bone. Fossa are the most common type of depression found on the human skeleton. Examples include the mandibular fossa of the temporal bone, the iliac fossa of the pelvis, and the coronoid fossa of the humerus. This provides space for the coronoid process of the ulna when the forearm is fully flexed. Lastly, a sulcus is a narrow groove. An example is the intertubercular sulcus of the humerus, located on the proximal side. It acts as a channel for the tendon of the long head of the biceps brachii muscle and also provides attachment for the latissimus dorsi muscle.
The next type of bone marking is an opening. An opening is any type of passageway that allows nerves and vessels to travel through the bone. Today we will look at 3 different types of openings: canals, foramen, and sinuses. First, we will look at a canal. A canal is a passageway through a bone. For example, the optic canal is located in the eye socket of the skull, and it connects the orbit to the middle cranial fossa and allows for the optic nerve and ophthalmic artery to be transmitted. Next, we will be looking at a foramen, which is a rounded passageway through a bone. Looking at the skull, we are able to see the foramen magnum. This is a large opening in the inferior part of the cranial fossa that allows spinal nerves, as well as spinal and vertebral arteries, to pass through the skull. It also allows the spinal cord and brainstem to continually go through the body by passing through this opening. Lastly, we will be looking at a sinus, which is a cavity or hollow space in a bone. An example of a sinus is the frontal sinus, located in the frontal bone of the skull, superior to the orbit. The frontal sinus is one of the paranasal air sinuses that allows for voice resonance and is a common place for sinus infections.
The third type of bone markings are projections. Projections are markings that are raised or stick out away from the rest of the body. Often they form attachment sites for muscles and ligaments. The first example of a projection is the trochanter of the femur. It is a large quadrangular projection between the neck and shaft of the femur bone. It provides attachment for many of the muscles in the gluteal region, not including the gluteus maximus. The next example is the mastoid process of the skull. It is an external conical projection connecting to the temporal bone of the skull. It provides attachment for the splenius capitis, the sternocleidomastoid, and posterior digastric muscles. If you put your finger right behind your ear, you should be able to feel a large bump. This is your mastoid process. The final example of a projection is the deltoid tuberosity. It is a roughened raised area on the anterolateral side of the humerus. This provides attachment for the deltoid muscles in your shoulder.
The last type of bone marking is an articulating surface. These are surfaces covered with articular cartilage that allow bones within a joint to move relative to one another. 3 common articulating surfaces that I will mention today are heads, trochleas, and condyles. For example, this is the head of a femur. It's a smooth spherical epiphysis that is on the most proximal part of the femur. This allows the bone to articulate with the acetabulum of the hip bone to form the ball and socket hip joint. This is the trochlea of the humerus. It's a grooved surface on the most distal end of the humerus. This surface allows for a pulley-like process for the hinge joint that it forms. It articulates with the trochlear notch of the ulna to make up the elbow. And finally, the condyle of the femur is another example of an articulating surface. This is made of smooth oval structures at the distal end of the femur. In fact, it is divided into 2 structures, a medial condyle and a lateral condyle. Both of these articulate with the tibia and patella to form the knee joint.